My name is Milos Jesenak and I'm a pediatrician and clinical immunologist. I'm working in the University Hospital in Martin, which is a small university city in the middle of Slovakia. I'm professor of pediatrics at Jesenius Faculty of Medicine of Comenius University in Bratislava. In my daily practice, I'm taking care about children and adults suffering from different forms of immune-mediated diseases, like allergies, autoimmune diseases, and immunodeficiencies. Especially, I'm interested in different forms of immune support, like immunomodulation and vaccination. Immunology represents an exciting and rapidly developing part of the medicine and currently is infiltrating in all the parts of the modern medicine. The primary objective of immunology is immune system and immunity, and we know that immune system is an essential part of human organisms and is undergoing very rapidly developing during all the parts of the human life. We know that the immune system starts to develop during the gravidity, and during the period of adolescence we can say that the immune system is fully developed and has all the functionalities which are necessary for full and healthy life. The most important characteristics and function of the immune system is maintenance of homeostasis. So together we can say that immune system are trying to protect us against infections, is maintaining the surveillance over the tumors, and is protecting us against the developing of autoimmunity. Very important part of the defects of immune system are respiratory infections, and we can say that respiratory infections are one of the most common forms of infections in whatever age category. However, we can say that especially in the early childhood, we can speak about the diagnosis, which is called recurrent respiratory tract infections. The most susceptible period is between the 2nd and 6th years of life, and logically it's connected with the entrance of the child into the care attendance center. Very typical period for respiratory infections is from October to March, which is usually corresponding to the incidence of epidemics of various respiratory infections. Taking the frequency of respiratory infections in all the age categories, we have very high direct and indirect costs, which are connected with the management of respiratory infections. And what is alarming is the increasing antibiotic resistance. This is usually connected with overuse of antibiotics. We have several contributing factors and risk factors which can contribute to the higher frequency of respiratory infections, especially in the childhood. Among the most important is the older sibling, bigger family size, daycare attendance center, and of course various characteristics of immune system which can be named together like immune immaturity. All the other factors like pollutants, passive smoking, chronic diseases like primary ciliary dyskinesia, primary and secondary immunodeficiencies, cystic fibrosis, congenital anomalies of respiratory tract, gastroesophageal reflux, allergic inflammation or focal infections can be also contributing among these factors. But the most important are three: older siblings, daycare attendance center, and immune immaturity. Let's speak about the innate immune immaturity, because we know that the small children have very specific characteristics of airways and on the other hand also of the immune system. At first, they has decreased production of secretory immunoglobulin A, which is the most important immunoglobulin protecting the respiratory tract. On the other hand, small children has lower complement components. They do not have sufficient immune memory, which is trying to be built up during the vaccination. They have poor response to polysaccharides, and they have also lower neutrophil functions. On the other hand, we have several physiological and anatomical characteristics of respiratory tract. At first, the mucosal layer is highly vascularized. The mucosa is softer. There is a mild predominance of parasympathicus, which can lead to the bronchial obstruction during the infections. And then we have some other anatomical specificities compared to the adulthood and older life. During the evaluation of the child with respiratory tract infections, it's very important to distinguish between two categories. The first one is physiological respiratory morbidity, which in general means that for certain age category, we can consider certain number of respiratory infections, something like normal, without any underlying pathological conditions. On the other hand, for the patients and children with very high rate of respiratory infections, we can say and we can speak about the recurrent respiratory tract infections. This is the diagnosis which requires further evaluation, examination, and also some preventive and treatment approach. Physiological respiratory morbidity means that for children younger than 5 years, we can consider 6 to 8 episodes of respiratory tract infections of upper airways of mild course during the autumn and winter, like something physiologically normal, and usually the child outgrows from this rate of respiratory infections. For the children of school age during the adolescent period and for adult subjects, we can say that 2 to 4 upper airways infections of mild course during the autumn and winter is also something physiological. On the other hand, besides the number of respiratory infections, it's every time important to evaluate also the severity of these infections and possible complications and consequences. For those patients and children with higher number of expected respiratory tract infections per year, we can say about the diagnosis of recurrent respiratory tract infections. And in general, in the scientific literature, we know and we have a lot of different definitions, but one of the most practical one is that for the children under the age of 3 years, more than 8 episodes per year, and for the children older than 3 years, more than 6 episodes of upper airways infections per year can be considered like recurrent respiratory tract infections. And for this patient, we should perform certain type of the laboratory and clinical examination, and it's quite rational for this patient to recommend certain possibilities of prevention of these infections. Among the most important pillars of prevention and management of recurrent respiratory tract infections are sleep, relax, and healthy diet together with exercise and appropriate physical effort. Then it's very important to exclude the passive smoking, not only during the life, but also prenatally during the gravidity. In case of respiratory infections, it's very important to perform and to maintain the sufficient convalescence and appropriate symptomatic treatment. And then the 4th important step is that we should recommend certain type of the vaccination and of course the immunomodulation, which is the most important and crucial stone for management of respiratory tract infections. What is immunomodulation? Immunomodulation is therapeutical and preventive interventions which is aimed into the activity of immune system, and we are trying to move this activity towards homeostasis and towards the positive activity for the human life. In general, we can say that immunomodulation is especially aimed for conditions and diseases with changed immune reactivity. It can be decreased or even increased, and taking into account all the crucial steps and all the crucial mechanisms of immunomodulation, which is the normalization of immune functions, support of decreased defense immune reactions, and of course modulation of the inflammation and prevention of its consequences. In these cases, we can use the immunomodulation for secondary immunodeficiencies, for the patients with high respiratory and also some other type of the infections rate, for the patients with autoimmune diseases, and of course for the patients with the most common lifestyle diseases in the current days, which are the allergies. We have both natural and synthetic immunomodulators, but in general we can recommend that as a first line we should use especially the natural immunomodulators. On the market and also in the scientific literature, we can see many groups of this immunomodulation of natural origin, but only few of them possess sufficient scientific background evidence base for the use in the prevention of respiratory infections. One of the mostly studied are the biological active polysaccharides, which can be e.g. beta-glucans, alpha-glucans, mannans, and so on. On the other hand, we have very big group of different tools of phytotherapy, which are usually the extraction from different herbs. But we can say in general that these approaches are usually aimed for acute treatment rather than for prevention. Then we have group of peptides and proteins like immunoglobulins, thymus extracts, and transfer factors. Some of them are only on prescription, and they are aimed only for the very specific group of the patients with certain pathological conditions. Then quite popular are probiotics and prebiotics, but we can honestly say that for the recurrent respiratory tract infections, there is only poor evidence of the effectiveness for the prevention of respiratory tract infections. Let's speak more about one of the mostly studied natural immunomodulators, which are the biological active polysaccharides. Biological active polysaccharides can be very effectively used both for treatment but also for prevention of respiratory tract infections. And in the scientific literature, there are several reviews which are trying to summarize all the scientific data for the sufficient and effective use of these natural immunomodulators for prevention of respiratory tract infections. What is very important is that we have certain sources and origins for the beta-glucans or biological active polysaccharides, and one of the most effective one are those which are extracted for oyster mushroom, which is in Latin Pleurotus ostreatus. What is advantage compared to the other groups of immunomodulators? At first, there is a robust data for the safety of this group of immunomodulators. Then we clearly understand the mode of actions because several receptors were identified which are involved in the interaction of beta-glucans together with the immune system. The most important receptor is the dectin-1, which is on the surface of many immune cells. Taking into account all the data from laboratory experiments, animal data, but also from the human studies, we know that biological active polysaccharides possess complex immunomodulatory activity. It means that they are able to positively influence both innate and also adaptive immunity. Besides the immunomodulatory activity, they possess also very important additive beneficial modes of action, which are very useful in recurrent respiratory tract infections, like anti-inflammatory, antioxidative, anti-infective effects, and many, many others. Another very important thing is that taking into account the huge numbers of already treated patients in whatever age category, this group of natural immunomodulators possess very, very good, excellent safety profile with very good tolerability, so there is no risk for overstimulation of the immune system in certain indication and patients. Let's speak about the immunoglucan, which is one of the mostly studied type of the biological active polysaccharide, which is extracted from the Pleurotus ostreatus by patented technology, which was defined and also published in 1994. And we can say that biological active polysaccharides from Pleurotus ostreatus, which are known under the name immunoglucan, are insoluble. They possess branch structure, which is important for interaction of immune cells. It's produced by patented technology of extraction, and due to many studies, we can say that it possesses very complex immunomodulatory potential. All these characteristics are unique, and therefore it's not possible to substitute different biological active polysaccharides between each other, so there is no generic substitution. And if you would like to use something which is effective in particular indication, each time you should especially rely on the available studies with particular products. So there is no generic substitution like in classical chemical medicine. We have certain data which clearly shows us that this is really insoluble beta-glucan, which is acting through the immune cells in the intestinal wall and is not absorbed into the blood. This is the study which was performed in healthy volunteers before, during, and after the period of immunoglucan intake in different dosing regimens, and the authors tried to identify and to detect the immunoglucan in the peripheral blood of these volunteers, but there was no indication that immunoglucan was presented in the peripheral blood, so we can say that this biological active polysaccharide is working through the especially Peyer's patches, which are the immune organs in the intestinal wall, and after the activation of immune cells in this part of the immune system, then the activated cells are transferred through lymph, through blood, into other parts of the immune system, and they are just providing the achieved and acquired information in the intestinal wall, and they are just activating the immune cells, also in the distance part of immune system. What about the mode of action? So we know that insoluble immunoglucan is working through intestinal immune system, through Peyer's patches. The most important receptors involved in its immunological activities are dectin-1, complement receptor 3, certain toll-like receptors. They are very important, especially in the activation of immune cells against the viruses. There are certain indicators that probably the biological active polysaccharides are ingested by macrophages, and then these macrophages are, after the activation, providing further activation of the immune system. Another very important part of the mode of action of biological active polysaccharides is optimization of the cytokine network, so the decrease of pro-inflammatory cytokines and increase of tolerant and anti-inflammatory cytokines. Very important part of mode of action of these natural immunomodulators is also the activation of dendritic cells. Dendritic cells are type of the antigen presenting cells, and they are very important in translation of the immune information from the innate part of the immunity to the specific part of the specific immunity. Very important for immunoglucan is the same principle like for the other group of natural immunomodulators. So the patient should take this product for certain period of time. The best one is for certain weeks, because during the early phase we can see the activation especially of the non-specific immune mechanisms like the activation of monocytes, macrophages, activation of natural killer cells, and production of certain cytokines. And then later on during the late phase we can see also the activation of specific immune mechanisms like the activation of T cells, B cells, production of immunoglobulins, and also further activation of the beneficial cytokines profile. One of the most important functions of the immune system is the anti-infectious defense and protection of the body against different viruses, bacteria, parasites, and so on. We know that the immunity is divided into two arms. One is innate non-specific immunity, and another one is acquired or specific or adaptive immunity. But honestly, we should say that in reality, in the human body, there is no such clear borders between these two arms of the immunity, because all the immune parts are united system, and this is more academic division, just which is not respecting the true situation and mechanisms in the organism. Several years ago, we thought that the most important discriminating characteristics between these two parts of the immunity is the immune memory, which was considered as the essential characteristics only of acquired or specific immunity. But certain years ago, there are very important inventions. I should say these are one of the most exciting inventions in the modern immunology. And currently we know that also the innate immunity is possessing the certain forms of the immune memory, and this immune memory was called like trained immunity. So for specific immunity, we have immune memory. For innate non-specific immunity, we have the trained immunity, which is very important part of the clinical efficacy and activities of certain natural immunomodulators and vaccination. So what does it mean, trained immunity? So we know this is the characteristics of innate non-specific immunity, and is very essential part of complex defense mechanisms of organisms, not only against infections, but also against certain immune-mediated diseases. Comparing to the immune memory of specific immunity, trained immunity has a lower specificity and is usually in the hand of monocytes, macrophages, natural killer cells, and innate lymphoid cells. All these cells are part of the innate immunity. What are the principles and basic mechanisms of induction of trained immunity? At the beginning of induction of trained immunity, there are certain factors of internal and external environment, like infectious, vaccination, beta-glucans, and probably also some other forms of natural immunomodulators. All these factors are able to induce the epigenetic and metabolic reprogramming of certain cells of innate immunity, like monocytes, macrophages, and on the other hand, also natural killer cells and innate lymphoid cells. Due to these changes, it comes to the changes of functional programs of immune cells, which leads to the increased or decreased cellular responses. But the most important consequence of this is that based on this epigenetic and metabolic reprogramming, there is a change and improved reactivity of immune response to the secondary stimuli and triggers. So at the beginning, there is an induction of trained immunity, and later on, there is a better response and better protective immune response to certain stimuli and triggers. As it was said, the beta-glucans or biologically active polysaccharides are a very effective tool for trained immunity, and due to several publications, scientific reports, animal studies, there is sufficient evidence that beta-glucans leads to the long-term reprogramming of monocytes and natural killer cells with subsequent increased activity of selected metabolic pathways. And therefore, this immune training can lead to the better and more effective response to the infectious, for example, like viruses. And taking into account all the publication and current scientific data, we can say that biologically active polysaccharides are the first group of natural immunomodulators with proven effects on trained immunity induction. And this supports the use of beta-glucans in prevention of treatment of selective diseases, especially those diseases connected with changed and decreased immune reactivity. Immunoglucan is representative biologically active polysaccharides, and its active substance, which is extracted by patented technology from Pleurotus striatus, is available in 3 galenic forms, depending on the aimed group category of the patients. So we have syrup, we have sachet, and we have the capsules. The main indication for long-term use of immunoglucan is the long-term support of immune system and prevention of recurrent respiratory tract infections in healthy subjects, but also in certain groups of the patients and risky patients. What are the basic characteristics of immunoglucan P4H? At first, we should summarize that this product has proven efficacy in different studies and different conditions, both in vitro, animal studies, healthy volunteers, sportsmen, then open-label studies and placebo-controlled studies in healthy children, but also in certain groups of the chronic diseases. It's compatible with other immunomodulators, and what is crucial for the use of different forms of natural immunomodulators is the use of synergic mode of actions of different immunomodulators. So immunoglucan can be combined with vitamin C, zinc, bacterializers, and so on. Very important result from the studies which were published in different journals is that immunoglucan possess very good tolerability and excellent safety profile. It was proven in healthy volunteers, in chronic ill diseases patients, and also in healthy volunteers and in children. Based on these characteristics, we can summarize that the immunoglucan is the only biologically active polysaccharides with proven efficacy in prevention for recurrent respiratory tract infections in children. And currently, when we are using different forms of immune support in the current medicine, it's very important to use only those products which possess certain evidence for their clinical efficacy and safety. We can speak that immunoglucan in the context of evidence-based medicine is very useful and very effective tool of prevention of recurrent respiratory tract infections. So let's have a look on the results of certain different studies which were performed with immunoglucan P4H, especially in children, but also in other group of the subjects and patients. The first pilot open-label study was performed in Czech Republic and Slovak Republic, and in this study, which was multi-center, we had 270 children which were aged approximately 4.7 years, and the most important inclusion criteria for this study was more than 5 upper respiratory tract infections in the prior 12 months before the entering into the study. There was a standard dose based on the body weight of the subjects, and the application was for 3 months, and then there was a follow-up with a observation of the respiratory morbidity. What was very important is that positive therapeutic response, so it was defined like more than 50% reduction of respiratory morbidity, was observed in approximately 71% of the children. And in general, we observed approximately 60% decrease in number of upper respiratory tract infections, which was statistically significant compared to the previous year before entering into the study. This pilot study was a stimulator for planning the open label studies in also other geographical settings and other parts of the Europe. So at the beginning we had a study in Czech Republic and Slovakia, which was followed by the study in Spain. Later on we moved to the northern part of Europe, to Poland. Then there was a simultaneous study in Slovenia, Croatia, Bosnia and Herzegovina, and the last two countries which also contributed with their data to the open label studies was Serbia and Turkey. All these studies had the same design, and they were aimed on the proven of efficacy of immunoglucan P4H liquid in children with recurrent respiratory tract infections, which were aged from 1 to 12 years. We used the definition of recurrent respiratory tract infections by De Martino from 2007, and the children were enrolled into the study based on the number of recurrent respiratory tract infections. For the children younger than 4 years, it was more than 6 episodes. For children older than 4 years, it was more than 3 episodes of respiratory infections in the previous 12 months before enrolling into the study. The study consists from 3 months of supplementation of immunoglucan and then 3 months of follow-up, and we compare the observed respiratory morbidity with the same period from the previous year before enrolling into the study. Dosage was according to the body weight, which is the standard dosage of this product. Altogether, we had 1,247 enrolled children of mean age 3.8 years, which is absolutely incredible number for the open label study with natural immunomodulators. Number of patients who completed the study was 1,209. The most important result was the change and decreased frequency of recurrent respiratory morbidity, which was more than 45% decrease, which was statistically significant compared to the previous year before enrolling into the study. When we have a look on the particular type of the respiratory infections from upper respiratory tract to the lower airways, so common cold, otitis media, tonsillopharyngitis, laryngitis, to bronchitis and pneumonia, we observed the statistically significant decrease for all these type of the respiratory morbidity. Moreover, when we compare the duration of the respiratory infections, we also observed approximately 50% decrease of the days in which the child suffered from respiratory infections, and this was also statistically significant. Also, the analysis according to the particular type of infections from upper airways to the lower airways was statistically significant for all the duration of all the subtypes of respiratory tract infections. Very important was the evaluation of the product efficacy, which was performed by physicians but also by the parents. And as you see, there is a big agreement between the final evaluation of the parents and physicians. So 93% of the parents and 96% of the physician evaluated the product like very, very effective, which is very good because there was big agreement between the physician and the parents. Regarding the side effects which can be attributed to the study product, the frequency was 0.24%, which is very, very low and very positive and beneficial for these natural immunomodulators. The majority of the withdrawals was due to the non-compliance with the study protocol. So how to summarize the results from all the open label studies across the Europe? In all the geographical settings, we observed the decrease of the number and duration of, in general, respiratory tract infections, but also of particular forms from upper to the lower airways. without any severe side effects, with excellent tolerability, without any warning signs for overstimulation of immune system. There was also a statistically significant decrease of some secondary endpoints like emergency visits and missed school from the days. And there was very high agreement between parents and healthcare providers regarding the reported efficacy. Consistent results, which were observed in different geographical settings, different children population with different genetic background, is very beneficial and is confirming the general good efficacy of immunoglucan for preventing of respiratory tract infections. Besides open-label study, we also performed the double-blind placebo-controlled study, which is in the pyramid of evidence-based medicine on the upper parts. This study was performed in Czech Republic and Slovak Republic. This was multi-center study, and one part of the children was treated by immunoglucan. Second part was treated by active placebo, which was vitamin C, because we just wanted to distinguish between the true efficacy of active substance, which is in immunoglucan from Pleurotus striatus, and between the vitamin C, which can has also some immunomodulatory activity. The most important results from this double-blind placebo-controlled study was, in general, decreased morbidity in actively treated patients, which was expressed by the higher percentage of absolutely healthy children without any respiratory infections during the study period, which was statistically significant in immunoglucan P4H arm. In this study, we also observed the decreased number of lower respiratory tract infections, which is very important because some other studies with biological active polysaccharides usually confirms only the efficacy for prevention of upper airways infections, but in this study, we also confirmed the positive efficacy for lower respiratory tract infections. We also studied selected parameters of immune system. In cellular part, we did not see any overstimulation, any warning signs for overactivation of the immune system. But very interesting were the results when we analyzed the isotype of immunoglobulins, so IgG, IgA, and IgM. As you can see, the blue lines, which express the changes during the application of immunoglucan, favors the use of immunoglucan for promotion of physiological maturation of this part of the immune system in children. So there was a mild, statistically significant increased promotion of production of various forms of isotype of immunoglobulin, which is very good, especially when we have a look on the immunoglobulin A, which is very important part of the protection of respiratory mucosal layer. After the evaluation of the treatment efficacy on the prevention of respiratory tract infections and on the selected immune parameters, we were also interested in the treatment evaluation efficacy, which was performed by the treating physicians in blinded manner. So they did not know which child was treated by immunoglucan and which child was in a placebo arm. The evaluation, very good, was reported more frequently and statistically significantly in active group, so in the children which were treated by immunoglucan P4H. What are the most important outcomes and results from this double-blind placebo-controlled study with immunoglucan P4H in small children suffering from recurrent respiratory tract infections? Active treatment with immunoglucan P4H for 6 months resulted in statistically significant decreased number of respiratory tract infections, of flu and flu-like diseases, and also of lower airways infections. In general, in active treatment arm, we observed increased number of completely healthy children, so the children without any respiratory infections during the observed period. Also, this trial confirmed a very important excellent safety profile, not only regarding the missing markers of overstimulation of immune system, but especially on the other laboratory parameters like liver enzymes, glycemia, and other, which were absolutely without any statistically significant differences between the active treatment and placebo arm. The product was good, tolerable, and all these results supports the use of these natural products for prevention of respiratory tract infections in long-term use in small children, but also older children. Sport activity can have many positive beneficial effects on the human body, but on the other hand, we know that there are also some consequences in the immune system. Exhausting sport activity, for example, in elite athletes, can lead to the transient immunosuppression after the physical effort, and these findings in the immune system is called immunosuppressive window. This is characterized by decreased mucosal immunity, especially decreased concentration of immunoglobulin A, decreased number and functionalities of natural killer cells, and decreased phagocytic activity. After the relax, it comes to the restoring of immune functions, and there are no consequences of these transient immunosuppressive windows. On the other hand, if there is no sufficient relax, it comes to the summarizing of immunosuppressive windows and to the development of chronic secondary immunodeficiency of various degree. One of the clinical expression of this secondary immunodeficiency after exhausting sport activity is the increased number of respiratory tract infections, and they have negative effects on sport performance. Immunomodulation can represent one of the possible tools how can we prevent the development of immunosuppression and how can we prevent the respiratory tract infections in sportsmen. There are several publications with immunoglucan P4H which were in a double-blind placebo-controlled manner, and they were aimed on the study of prevention effects of immunoglucan P4H on selected laboratory parameters and respiratory tract infections in athletes and elite sportsmen. The most important results from this study is that immunoglucan P4H compared to the placebo arm reduced the immunosuppression after intensive training and prevented the development of immunosuppression. Immunoglucan P4H normalized the immune functions, like it increased the number of circulating natural killer cells, stabilized the natural killer cells activities in the phagocytosis, and in general lead to the decreased number of respiratory infections. So in general, we can say that immunoglucan P4H can have very positive effects on sport performance and can modulate and prevent the immunosuppression which can be observed after the intensive sports effort and physical training. Immunomodulation represents a therapeutic and preventive strategy for the subjects and patients with changed immune reactivity. So therefore, besides the use of immunomodulation in healthy subjects, sportsmen, small children, it can be used also under certain conditions for patients which are suffering from chronic inflammatory diseases, which can lead to the increased respiratory morbidity. One of the possible indications is the use of biologically active polysaccharides in allergies. Allergies are currently affecting approximately 30% of world population, and during the next few years, we can expect that every second subject will be suffering from the certain forms of allergy. Allergies are the most common forms of lifestyle diseases with increasing incidence and prevalence. And on the other hand, it's well known that allergic patients are more prone to suffer from increased respiratory morbidity. Taking into account the fact that biologically active polysaccharides possess complex immunomodulatory and anti-inflammatory and anti-allergic properties, we can also suppose that biologically active polysaccharides can be effectively used for the patients with certain type of the allergic diseases. Biologically active polysaccharides have quite sufficient amount of the data from experiments and laboratory data and animal studies, which confirmed certain positive effects on the cytokine network, on the inflammatory markers and allergic markers. On the other hand, several studies were published with the subject with bronchial asthma, allergic rhinitis or atopic dermatitis, especially with systemic application of different forms of biologically active polysaccharides. Analyzing the results of double-blind placebo-controlled study with immunoglucan P4H, which was predominantly aimed on the prevention of recurrent respiratory tract infections, we also evaluated the influence of immunoglucan P4H on the selected markers of allergic inflammation. The first one was the concentration of total immunoglobulin E in the peripheral blood, which is a non-specific marker of allergic inflammation and allergic diseases. In the active group, the total concentration of immunoglobulin E in the peripheral blood was stable during the whole treatment and follow-up period. Conversely, in the placebo arm, total IgE gradually increased. Comparing the proportion of allergic children in both groups, in active treatment and also in placebo arm, there was no statistically significant difference. But based on this, we observed the stabilization of total IgE concentration in the active treatment. Another important and direct allergic marker is the number of blood eosinophil counts. And comparing two arms of this study, we found that immunoglucan P4H was able to decrease the total number of blood eosinophil count compared to the placebo arm when no changes were observed. So what can be extracted and summarized from this study and from this observation? The first thing is that immunoglucan P4H has possible anti-allergic effects and is able to stabilize and even to suppress certain allergic markers. On the other hand, immunoglucan P4H is safe also for allergic patients, and this can represent one of the possible tools for prevention of respiratory infections, which are common exacerbator of allergic chronic respiratory diseases. Immunoglucan P4H has complex biological activities, and besides anti-allergic effects, it possesses also the anti-inflammatory and immunomodulatory effects. Therefore, we studied the efficacy of immunoglucan P4H also in another forms of chronic inflammatory respiratory diseases. The first one was chronic obstructive pulmonary disease, which is typical chronic respiratory disease of adulthood. In this study, which enrolled 64 patients with GOLD group D stage of COPD, the authors studied the positive effects and possible effects of immunoglucan P4H for the prevention of exacerbation of COPD. The patients were divided into two arms. This was open label but controlled study. In active arm, the subjects were treated by immunoglucan P4H, one capsule each morning. One capsule contained 100 mg of immunoglucan together with 60 mg of vitamin C and 5 mg of zinc. Second group was treated only by vitamin C and zinc in the same dose as was in the capsules containing also immunoglucan in the group 1. Patients took one capsule per day for 3 months during the risky infectious period from December to April, and there was a comparison between these two groups regarding the number and also duration of the exacerbation of COPD. As you see on the graphs, in active treatment, which are the blue bars, there was a statistically significant lower frequency of COPD exacerbation and also a shorter duration of COPD exacerbation. So altogether, this trial supports the use of immunoglucan P4H as complementary positive preventive tool for bacterial exacerbation of COPD, which has positive effects on the prevention of number of duration of COPD exacerbation, but also another important result was no side effects which were reported in correlation to the active treatment. Besides COPD, another diagnosis which was studied with the possible clinical efficacy of immunoglucan P4H used were bronchiectasis. In this group, there was 61 non-cystic fibrosis bronchiectasis patients on stable chronic treatment, and these patients were divided into two arms. One was treated with immunoglucan. These capsules, besides immunoglucan, contained also vitamin C and zinc, and another group, so group 2, was treated only with the same dose of vitamin C and 5 mg of zinc. Patients took one capsule per day for 3 months. Very interesting results are presented in the graphs, and as you can see, immunoglucan P4H resulted in the lower number of exacerbation of bronchiectasis and also lower and shorter duration of this exacerbation, which was statistically significant compared to the second group, which was treated only with the same dose of vitamin C and zinc without immunoglucan. For these patients, no side effects were reported, and this treatment was shown to be not only effective but also safe for these chronically ill patients. Immunomodulation as preventive and therapeutic strategy can be used under certain conditions also in autoimmune diseases, and I should say this is quite challenging indication for the rational use of different immunomodulators. Autoimmune diseases are currently affecting approximately 7 to 8% of European population, and they are the consequence of interplay between the genes, extrinsic and intrinsic factors. Each autoimmune disease, whether it's organ-localized or systemic autoimmune disease, is characterized by chronic inflammation and immune dysregulation. The standard therapeutic approach for diseases of autoimmune origin is the use of immunosuppressive therapy. Combination of immune dysregulation, chronic inflammation, and immunosuppressive therapy leads to the profound immunosuppression with immunodeficiency development, with decreased anti-infectious defense. As a consequence of this, in patients with autoimmune diseases treated with different tools of immunosuppressive therapy, we can observe increased infectious complication, and each infectious attack can worsen the clinical course of basic chronic autoimmune disease. Therefore, there is urgent need for the tools how can we interrupt this vicious circle of autoimmunity, immunosuppression, and infections, and one of the possible application is the use of immunomodulation. Immunoglucan P4H and autoimmune diseases, we can summarize some of the crucial results, especially from the animal models of different autoimmune diseases like arthritis or ulcerative colitis. But we also have the study of immunoglucan P4H in the adult patients with Crohn's disease treated with biological therapies. The summary of animal models of autoimmune diseases in which we applied immunoglucan P4H is that this active treatment was able to decrease the disease activity and objective symptoms, for example, of arthritis. They were able to decrease the respiratory infectious rate. They also supported the efficacy of applied therapy, for example, methotrexate, and also immunoglucan P4H was able to decrease the side effects of immunosuppressant and improve the tolerability of applied chronic therapy. We did not observe any exacerbation of chronic autoimmune disease. On the other hand, we also analyzed certain laboratory markers. Immunoglucan P4H decreased the production of pro-inflammatory cytokines, improved and increased the antioxidative capacity, and in case of ulcerative colitis animal model, immunoglucan P4H decreased the probability of development of precancerous colonic lesions. As it was mentioned, immunoglucan P4H was studied also in a group of patients with Crohn's disease, which were treated with TNF-alpha blockers during the stable period. We aimed to study the immunoglucan P4H efficacy on the prevention of intercurrent infections. Important results in this group of 53 patients are that immunoglucan P4H significantly reduced the respiratory morbidity compared to the placebo group, and there were no changes of disease activity of our laboratory tests. So it was proven that immunoglucan P4H under certain circumstances is also safe for the patients suffering from chronic inflammatory autoimmune diseases. Let's summarize some practical tips for the use of immunoglucan P4H in the clinical practice. There is no need to interrupt this treatment on occurrence of any acute infectious symptoms because there is no interaction with any other concomitant treatment of acute infections. Moreover, it's recommended to increase the dose of immunoglucan P4H during the acute symptoms for several days and then come back to the classical preventive dose. Moreover, there is no need to stop or interrupt immunoglucan P4H treatment during the course of antibiotics because there is no interaction with this. But on the other hand, we can expect the possible decreased need for antibiotics treatment in appropriate application of immunoglucan P4H in your patients. What are the most important characteristics of immunoglucan P4H which are prerequisites for its successful use in daily practice? At first, it's produced by patented technology of isolation of active substance from the natural source, which is the Pleurotus striatus or oyster mushroom. And this technology and these characteristics was published in 1994. The clinical efficacy of immunoglucan P4H was proven in many clinical studies and trials in children, adolescents, adults, in patients with chronic kidney diseases, or in healthy subjects and healthy volunteers, by open-label manner or by placebo-controlled double-blind studies. Across all the studies, all the age categories, immunoglucan P4H showed clear, excellent safety profile with minimum side effects, without any severe side effects, with no signs of overactivation of immune system, without no sign of overdose. It has very simple dosage scheme, which is applied once per daily, which is associated with appropriate compliance of the patients. Moreover, the small age category has the possibility of dosing according to the weight, which has the individualized approach for the treatment of this natural product. Moreover, it's clear natural product without colorants, without aromas, without alcohol ingredients, and therefore it can be safely used also in the small age category. Thank you for your attention and enjoy use of immunoglucan P4H in daily practice.
Immunoglukan P4H. Currently this year we are celebrating 20 years of this product, and it's quite very good that also in case of natural product and food supplement, there is increasing evidence for use in different clinical conditions and indications, since this is quite unusual in many other natural substances that usually the evidence-based experience is just missing in case of some of traditionally used food supplements. But in this case, in case of the biological active polysaccharides, we can just see year by year increasing evidence that they can be used not only effectively but also safely, which is very important. Natural immunomodulators can, on one side, improve the post-vaccination response in those patients in which we suppose that there is no optimal post-vaccination response. On the other hand, natural immunomodulators can decrease some other respiratory infections against which we do not have any possibility for vaccination. So it's quite a good combination. Well, there are several studies with various sources of beta-glucans, not only with immunoglucan, but also some other beta-glucans, with sportsmen and different athletes. And what we know is that the preventive application during the especially period with intensive training and intensive physical effort can prevent the immunosuppression, which is associated with high and very dramatic physical effort. So currently we have also very nice data from double-blind placebo-controlled trials. We know that this is the possibility. How can you even prevent the immunosuppression after the sport effort? You can improve the, for example, mucosal immunity and prevent the respiratory infections. In case of the sportsman, you can also use a little bit higher dosage, like 2 capsules every morning. It was also studied in the trial. So it's a little bit higher dosing compared to the standard application dose, compared to the standard population. Since there are a lot of available data regarding the long-term safety, which are very good. So in case there is a positive response and still there is a remaining increased risk, for example, for respiratory infections, for example, in some chronically ill patients or in some athletes during the long-term physical effort, it's also possible to use it for also longer, like 1 year and so on. Currently, we have also under investigation the data from new clinical trials with immunoglucan, also with half year of application, also in higher dosing. So we will see what will be the results, and we are going to publish it. But basically, there are maybe 2 or 3 strategies. Either you can prepare the immune system before the risky period, which is the autumn and winter. So we can start at the end of the August or September. And to apply it 3 months, then short break for several weeks, and then another round of 3 months, or you can apply it 6 months during the whole risky season. And then for summer, in case that there is no other risky factors, you can also stop it and just start within the next season. So there are a lot of, also we should take into account the individual responsibility to for example, immunoglucan. So in case there is a positive response, you can continue. Also, it depends on the type of the patients, on the phenotype of the patients, and about the cooperation with the patients. Currently, in the age period before the age of 3 years, this is usually the increased respiratory morbidity is connected with the introduction of the child into the kindergarten or some other daycare attendance center. We have also data for younger children at 3 years, so it's possible to use immunoglucan. In general, beta-glucans are very safe also for young children, but usually we recommend to start the application of whatever immunomodulatory treatment after consultation of at least pediatrician, only for one reason, because in the small age category, due to in children with high respiratory morbidity, you can have also the children with primary immunodeficiencies, so inborn errors of immunity. So therefore, it's very important before the start of immunomodulatory treatment to evaluate whether in this child we do not have to exclude the primary immunodeficiency. So small children, it's possible to be used, it's safe, it's also effective based on clinical trials, but it's very, very rational due to the possibility of primary immunodeficiency in which none of the immunomodulators is effective since there is genetic defect in the immune system. It's very important and rational to, before whatever type of the immunomodulatory support, to consult and to exclude the primary immunodeficiency, just to shorten the time for which the child would not be diagnosed and would not be treated appropriately. But it can be used also in younger children. Vice versa, it can be quite beneficial because you can use the synergic effect of various immunomodulators. In general, the combination of immunoglucan together with vitamin C and zinc can be also found in the immunoglucan syrup or in capsules. But standardly, we are combining this, for example, with vitamin D, vitamin C, and so on. So natural immunomodulators can be also synergically effective and active. Combination of various immunomodulators like beta-glucans together with bacterial lysates and, for example, some chemical immunomodulators can be like second line or second stage of the treatment, because at the beginning you can start with one natural immunomodulator together with some vitamins and minerals. If it's not fully effective, you can add something to this, but we do not fear of the use of different immunomodulatory support tools, since you can use the synergic effect of those, because each of these substance is acting in a little bit different mode in the immune system, so you can activate the immune system by different ways. In general, we see the beta-glucans can have also anti-allergic effects. This is very important, and anti-inflammatory effects. But the synergic effects with for example, bronchodilators was not proved by the clinical trials. But currently, we are before the publishing the data with children with bronchial asthma, which were treated with immunoglucan as a support treatment, besides the inhalation therapy and so on. And we saw very dramatic and very good effects on the improvement of control of the asthma. So in case of the acute respiratory infections, beta-glucans can be used as a standard part of the treatment. You can use also even the updosing, like to fold time, increase dose. But true synergic effect with bronchodilators was not studied in the clinical trial. Once again, thank you for the invitation. I was very pleased to spend some time with you, and I just wish you stay healthy and keep safe. And hopefully next year we will be after this strange period of COVID-19, and we will be back to the standard medicine and to the standard diseases which are more interesting than COVID-19.
Right. Well, thank you a lot. Thank you a lot.